Hi, my name is Robert Palmer, CEO of PotentiaMetrics. PotentiaMetrics provides payers, providers, medtech companies personalized and predictive information to drive value-based care. The company's outcomes and insight products for cancer and cardiac surgery uncover what works for whom, under what circumstances, and at what cost. Today, healthcare outcomes metrics are largely based upon volume and procedural measures. It is estimated that 50% of treatments are not providing the expected benefit and are potentially harmful. Therefore, political and competitive mandates are forcing outcomes-based compensation, yet outcomes-based incentives are difficult to define and measure. This is Dana. She represents one of your members who has been diagnosed with cancer. The treatment decisions Dana makes will have profound clinical and economic implications for her personally, her employer, and her insurance company. Dana is seeking personalized information to make value-based decisions, yet Dana, her clinicians, and her payers do not have access to this information. In other industries, rating agencies define and compare outcomes to provide transparency. Yet who is providing this information today in healthcare? PotentiaMetrics is the independent third party that defines, analyzes, and reports outcomes for value-based care. PotentiaMetrics outcomes and insight platforms have been developed over the past decade. And during that time, we have gathered new real-world outcomes data across the continuum of care, developed proprietary analytics platforms to define and personalize predictive outcomes, including cost, across the full cycle of care, quality of life measures, expected complication rates, and survival. This is precision information based upon combining unique data and analytics not available from other sources. Outcomes and risk are determined at an individual level. To demonstrate how PotentiaMetrics platforms support value-based care, let's revisit Dana's case. Dana is considering 3 hospitals recommending different treatment decisions. PotentiaMetrics platforms reveal personalized and risk-adjusted outcomes for patients like Dana based upon these different choices. Personalized information about survival and complication rates. In this example, survival difference is as much as 7% just based upon center selection. If this was a drug, it would be a blockbuster. We define total cost based upon a full cycle of care. In this example, we've observed as much as a 15% difference in cost of care and related out-of-pocket expense. We can explore hospital satisfaction and quality of life indications as defined by cohort. With this information, Dana considered the trade-offs and selected Hospital A, which offered a lesser degree of treatment. We expect that personalized treatment in cancer care could result in $18 billion in annual cost annually, and a measurable difference to patients as far as quality of life and functioning. We provide value to payers, providing personalized treatment information and risk-adjusted outcomes by center, and outcomes and insight platforms for managers to empower patient decisions. Providers use our platforms to define risk, benchmark, and improve performance. MedTech companies use our insights and outcomes and insight platforms to compare effectiveness. PotentiaMetrics platforms have been developed over the past decade in partnership with Washington University School of Medicine. Analytic solutions have been reviewed by experts at leading universities and published by Harvard Health Policy Review. Our team has the diverse skills and experience to revolutionize healthcare. Members of our team have made significant innovations, including Cox-Maze procedure for cardiac surgery and ACE-27 to define the importance of comorbidity. Members of our team have decades of experience in both running companies and clinical programs. Market forces demand value-based and accountable care. Defining outcomes requires new clinical and economic metrics beyond adherence. Compensation will be tied to these metrics, and therefore change will occur quickly. PotentiaMetrics is playing a significant role in this evolution, and we are looking for partners in our quest. Thank you.